winner! You're a winner! You're a man! You're a man! You're a man! You're a man! Doctor wants you strong. Oh, I'll make you strong. I'll make you real strong. Oh! Oh!
Hi, Bobby. Whoa! What are you doing?
Well, I had knee surgery about a week ago, and my doctor said that I need to strengthen the muscles around it. And what's more stronger than a hammer?
You're going about it the wrong way. So what you want to do is you want to engage in an exercise program specifically designed to help aid your knee joint as it recovers post-surgery.
Will you show me how, Braden?
Now, for a brief anatomy lesson. The muscles of the leg. On the upper leg, we have the quadricep muscle. As we move closer to the inside and the middle, here we have the sartorius muscle, and then further inside we have the adductor group. As we flip to the back of the upper leg, we have the hamstring group, and then just below the hamstring group, we have the gastrocnemius, the main upper calf muscle, which begins at the back, at the upper portion of the back knee, and extends to the heel. This muscle also supports the femur bone. The femur bone is the upper leg bone, which then extends to the patella. Hold still. And then just below the patella, we have the tibia, which is the main and strongest bone of the lower leg. It bears most of the weight. To the outside of the leg here, we have the fibula, which is secondary to the tibia and helps supporting the lower leg. So now to briefly touch on some of the key ligaments involved within the knee joint. A ligament is a strong, dense structure designed to stabilize a joint. To the inside of the knee, we have the MCL. To the outside, we have the LCL. These are both thick connective bands that work together in order to help stabilize the knee joint. On the front, we have the ACL. Its primary function is to prevent excessive sliding of the lower leg bone, the tibia, in relation to the upper leg bone, the femur. It also helps to reduce rotational movements of the knee joint. So now, I'm going to give you a few exercises that you can do to help strengthen the muscles around the knee joint. This can help with faster recovery and reduce the amount of pain you experience.
Perfect.
Okay? Now, do you have like a rope or a rubber band of sorts that we can use for
Chain work?
So the first exercise we're going to be doing are heel slides. This will assist with your knee flexion. If you grab a rope or anything you have lying around the house, like this chain for example, that you can use for resistance. Place the foot of the involved leg in the middle here. Hold each end with your hands and slowly pull the cord while bending your knee until you feel a light stretch. You're going to hold this for 10 seconds and then release. You're going to repeat this exercise 10 times. Quad sets. The involved leg is going to be straight out, the one you want to strengthen, and these are going to help with stability and strength of the knee. So while seated, you're going to tighten your quadricep and try and straighten your knee. You're going to hold the contraction for 5 seconds until you relax the muscle completely. Do 3 sets of 10, eventually working up to 5 sets of 10 as you get stronger. The final exercise I'll cover today will be the straight leg raise. Again, the involved leg will be straightened. You're going to lie on your back with your involved leg, and then you're going to keep the other leg bent, like so. Start by slowly lifting your leg about 6 inches off the floor, and you're going to count to 4 seconds while lifting, and then 4 seconds down. Up, and down. You can perform 3 sets of 6 to 10 repetitions. As your strength increases, you can perform more reps or consult your physician about potentially adding ankle weights. So these are the exercises that I will leave you with. This is what I would personally recommend. You need to discontinue if you're experiencing pain, and try and really just ease yourself into it at your own pace. It is also very important to consult with your physician and follow any specific guidelines or instructions that they give you. Alright?
Thank you, Braden. I got a little crazy there, but you really showed me how to make my knee feel better. You take it easy, okay?
Thank you, Bobby. We'll see you next week.
See you, Braden.